Hello and welcome to the Healing Element Podcast. I am your host, Kai Marie, and I am back with Thurston Smith. This is his fourth time on the podcast, and it's always a pleasure to have him on. If this is your first time joining us, welcome. You can catch new episodes of the Healing Element Podcast every Tuesday at 8 p.m. Eastern Standard Time. I do want to make a special note that this will be the last live episode of 2021 as we prepare for 2022, but I'll be posting some videos that have played throughout the year, so that way you can catch up on any episodes that you have missed. So with that being said, Thurston, welcome back to the podcast. I almost feel like you're my co-host.
Listen, I'll be more than happy to serve as your co-host. You do such a phenomenal, such an exceptional job of hosting the Healing Element Podcast. All my colleagues and some of my friends and family members that have taken time to view your podcast all rave about your personality, the quality of your programming, and all of that. So I'm really happy to join you again.
Thank you. Thank you so much. And it's always a pleasure having. I thank you for those kind words. I really appreciate it. And we want to make sure that you feel welcome. And like I said, this is your second home, so you are always more than welcome to come back here. So to let our listeners know what we're going to be talking about today, this is a very sensitive topic and very important as we move into the holiday seasons. We're going to be talking about your mental health and what you can do to make sure that you are getting learning how the tools that you need, I should say, that you can reduce stress and how you can manage different challenges that you may be facing during this holiday season. It could be the first time that you are going to have a holiday without a loved one. Maybe there's a loved one that is in your life but has a substance use disorder. So how do you manage all that when during this time, this is all about family and coming together? So Thurston is going to really provide some expert advice on what you can do to prioritize your mental and emotional health during this time, so that way you can have a season that you can truly enjoy. So with that being said, that's the discussion. But in case somebody has missed all the episodes that you were on before Thursday, could you just introduce yourself to the Healing Element Podcast family?
Thanks again, Kai, for having me. Well, my name's Thurston Smith. I've been in the behavioral health, mental health, substance abuse fields for over 25 years now. I currently serve as an adjunct professor at Union University. I've also served as an adjunct continuing education instructor at a number of universities and schools of behavioral health studies. I'm also a minister here in Memphis, Tennessee. Consultant in behavioral health training, which involves counseling and mental health and everything that's related to that, which also includes developing counseling programs for adults, families, and youth. And I'm also an accreditor. I also serve as an administrative and program surveyor for the second largest Health and Human Services accreditation body within the United States. That organization is called CARF International. CARF historically stood for the Commission on Accreditation of Rehabilitation Facilities, and since now CARF actually accredits health and human service entities outside of the United States. For example, CARF accredits programs in Great Britain, South America, Africa, and I believe New Zealand, and there's probably a couple of other countries there that I can't even remember. Canada, if I didn't reference that. So CARF is now CARF International. And so historically it was an acronym, but now because the scope of services that the organization provides spans outside of the continental United States and includes other countries, the organization now has an international perspective. Yeah.
Wow. So with that being said, we have the person that we definitely want to have a conversation with about mental health and substance use disorders. And this is a topic that's near and dear to my heart. Personally, in my family, around the holidays is tough, not only because dealing with the loss of loved ones that are not there to celebrate with you, but we also have had a lot of loss around the holidays, in which someone has transitioned on around the Thanksgiving time, around Christmas time. So it makes it even that much more challenging. So Thurston, with the work that you have done in communities and with families, what are some of the main stressors that you have seen that people experience during the holiday season?
Well, the holiday itself. Just about that, So given my experience, and some of this has to do with my professional experience, but then I'm also part of the human framework. So I've got my own anecdotal experiences. But when we start looking at the holidays, there are a number of stresses that accompany the holidays that directly relate to what we're discussing this evening. One of those dynamics has to do with the pressure surrounding meeting the needs of family members, which often involves purchasing of gifts and being available to various family members and even friends during the holidays, during the holiday season, particularly Christmas, this time of the season that we're in. The second, which I think is probably the greater, maybe either equal to or greater amongst these two stressors, have to do with family members that are no longer around. Lots of anxiety and, in some instances, depression that is connected to family members that have gone on, family members that have passed, in some instances, separations from loved ones, divorces, and those kinds of things. So just looking at those two dynamics, Kai, the holiday season can be, somewhat challenging for many people, particularly if they're not managing or watching their mood and they're not particularly taking care of themselves and relaxing and getting exercise and eating properly and those types of things.
And so in preparation for our conversation tonight, I saw that there was actually something called holiday blues. And in that article, it was saying how many times around Thanksgiving, Christmas, people could experience depression along the lines of what you were saying. And is a lot of that stem from that separation from friends or family, or wishing that they had that type of support network in their lives?
Right. So let's since we're having this discussion, let's talk a little bit about what depression is. So at least your viewers, the listeners can kind of have an understanding, because many folks use the term, and sometimes when the term is used, it applies, and sometimes it doesn't. So one of the first things that I want to say, and I do not have the percentage right off, but for the sake of your listeners, a significant number of individuals that suffer from depression either A, don't know it, and or B, never get diagnosed and treated for it. And so that it's important to understand that clinical depression or major depressive disorder is a clinical disorder that's defined by a number of symptoms and criteria. Now, if we start looking at the criteria that's listed within the Diagnostic and Statistical Manual for Mental Disorders, I believe there are actually 8 or 9 criteria, and an individual must meet 5 out of that 8. Matter of fact, it's 8 exactly, not 9. It's 8 criteria. An individual must meet 5 out of the 8 criteria in order to meet the diagnosis. But let me go through some of those criteria. Number 1 is significant weight loss or weight gain. Number 2, lack of interest in activities, particularly activities that the individual would normally be involved in, and particularly activities that the individual once had an avid interest. So let's say, for example, if I really like to play golf or tennis, and everybody, all family members and friends that knew me knew that I loved playing golf and tennis, and all of a sudden my interest in that just went away. So that's an example of one of the other criteria. A third criteria is guilt, remorse, and feelings of hopelessness, loss of appetite, is another. Just to name a few. Now, many individuals, Kai, will have some of those symptoms, but not all of them. But generally, when we're talking about at least being diagnosed with depression, an individual will display and have several of those symptoms at one time. And see, here's the funny thing that we have to understand. Individuals that suffer from depression are almost always operating or focusing in 2 planes or 2 dimensions. They're either obsessed about what happened, right? So that's relative to something that occurred in the past, or they're overly concerned about what may happen. And thus, either one of those fixations in those planes or dimensions that I referenced is problematic for the individual. And the reason why it's problematic is because it interferes with their present functioning. One of the other criteria that I didn't reference earlier was listlessness, and that can include individuals that just don't want to get out of the bed, don't want to go out, do not want to interact with people. So those are some of the core and common criteria for depression.
And so many people, Thurston, that may feel the depression as you explained it, because as you said, like a lot of times we kind of use that word loosely and say, oh, I'm depressed, but we really don't really understand what exactly that means. But going with the definition that you provided, sometimes are those kind of feelings already there, and the holidays just kind of raise to the surface what's kind of already there within that individual because of the added stress that's place of like the needing to maybe go visit family, or not having family, or needing to purchase gifts and maybe not having the money to purchase gifts? Does that kind of feed an issue that may already be present in the individual?
Well, sure. So here's one way of looking at it. If you already have a propensity, and by the way, if I didn't reference this earlier, depression falls under the category of what the medical or psychiatric category of what is referred to as mood disorders. Anxiety also falls under the same category. And so going back to your question, so individuals that already have a propensity or a likelihood and or a history of depression, any of those two or three that I just listed, and then are presented with additional stressors. So Christmas holiday, you know, although it's a fun time, it can be a memorable time, but it also can be an anxiety producing time.
For sure.
For the reasons that you just referenced, you know, particularly if you're one of those individuals and you want to meet the needs of, you know, your family and friends, whatever that may be in terms of gift exchange and you know, those types of things, depending upon how the individual processes that, can be, you know, pretty significant added stressor for them during the holiday. And if it's an added stressor, then it compounds whatever issues that they already have going on. That's what makes the holiday season kind of dangerous for many folks. Then to add insult to injury, if you introduce alcohol or other drugs into it, then you really got you have some problems. It can be pretty challenging. So number one, like I referenced earlier, many individuals that you probably know, right? And just because they're functioning, just because they come to work, just like alcoholism, doesn't mean that they don't have the disorder, right? And like many disorders progress in stages, you know, where individuals are functioning, some individuals function better, you know, and that kind of thing. So one of the indicators that we have as it relates to family members and close friends is that we know them, we know their patterns, we know their habits. So when we see a marked or distinct shift in what we know to be normal with them, then the red flags go up and we know that something's wrong. But in terms of people that we don't know, that we, you know, that are general acquaintances that we encounter you know, sometime on a regular basis, whatever that may be, once a week or, you know, once every other week or every other day, we don't necessarily know if they suffer from the disorder or not. Right. So we gotta kind of be kind of careful, you know, or rather broad-minded when if we're wondering if someone is struggling with any of those types of disorders, mood disorders, anxiety, depression, so on and so forth.
Right. No, that's so true, because it shows up different. You may have someone that, as you said, like, I can't even get out of bed. And then you may have someone that is getting out of bed, going to work.
Correct.
They're just able to mask it differently, but it is going to show up somehow in their life.
Correct. Now, here's the interesting thing. With the clients that I've worked with throughout the years, the Christmas holiday season is a tough time for them. Tough time for them. And one of the core, or if you will, one of the most prominent indicators amongst all of those people, if I can reflect on all of the clients that I've worked with, that I've counseled and, you know, had sessions with, that was struggling during the holiday season, one centerpiece that just about all of them was experiencing were experiencing and or experienced was connected with somebody close to them that they are either disconnected with because of death, divorce, incarceration. Really, really tough times for people. Grandmother, I can reflect now with individuals that I work with, and I, by the way, I have a niece, right, that I haven't seen in years, right, that was born on Christmas Eve.
Oh,
right.
wow.
Just to give you an example, but I remember clients, right, that I've worked with. I remember clients that I've worked with who have actually lost family members during the holiday season. Family members even on Christmas Day. Family members on Thanksgiving. Stuff like that. And it's really, really tough for them. Now, if those individuals already have a history of not solving problems effectively, have a history of depression, or even history of substance abuse, alcohol, or even other drugs, the holiday season again may present an added stressor for them.
And so, Thurston, for those that are listening, and maybe this is their first holiday season without their loved one, and maybe someone that they were close to, maybe a parent, a brother or sister, what advice would you give to them during the season? Because everybody deals with it differently. Some people, when there's a loss, they want to be around family, they want to be around others because they don't, maybe it feels less painful, if you will, because they're not alone. And then other people, having lost someone that they're close to, they could feel like, you know what, I just need some time to myself. And that could be hard with family when it's like, wait, why would you want to be by yourself? Like, we just lost so-and-so. Why do you want to be alone? We need to come together. And so some people could find themselves in a situation where it's like, well, I just feel like I need this alone time. And that can be challenging to communicate to family. So what advice do you have to kind of navigate through those type of tough conversations?
Well, if you were, so let's say, for example, hypothetically, it was your sister that we were talking about, and you obviously know your sister. That fits right into that example and category that I referenced earlier with because you know someone so well, you know when there's been a shift in behavior or market change, right? And how they conduct themselves and what types of activities that they're involved in, that kind of thing. So it all, so it's about the approach, right? So it's about, reaching out to your loved one. And, Virginia, let me talk with you a little bit about, what I observe, what I see going on. And then one of the things that you want to do, and you can call this to some degree carefrontation. It's not about confronting them, but one of the things that you want to do is validate the person. You never want to dismiss what somebody's experiencing. And and I tell folks this all the time, right? You never want to tell people you shouldn't feel such a way.
Right. Yeah.
And folks do that all the time. I don't think they mean any harm by that. But that's really a counterproductive statement. You never want to tell somebody you should not feel such and such and such a way. You understand? People are entitled to their feelings. It's theirs. They have to own them and they have to process them. So Kai, if you were going to your sister, I would encourage you to validate, and you validate that person by saying, I know you've had a tough time lately. I know the divorce has been real challenging. and and you want to reaffirm that by saying, and you know, I understand that, you know, I can only imagine that if I had went through that, you know, what I would be feeling. So you want to validate where that individual is, and affirm. You don't want to deny or shut them out of what their own experiences. But then you begin kind of start having a conversation with them about their values, and you do things like, you know, I know you like to bowl every Saturday. You stop bowling, stuff like, you know, stuff like that. Stuff like that, and you have to finesse that.
Yeah.
You understand what you understand?
Yeah, I like that a lot. Yeah,
and it's kind of interesting because I you know, I kind of know you, Kai, and I can see you asking me a question. Well, what can they do during the holiday season to kind of circumvent that? Well, here's the funny thing: the same pathway for coming out of depression during the holiday season is the same way of coming out of it any other of the 364 some odd days of the year. You understand? Or 330 or 40, whatever, you know. So we talk about the holiday season really encompasses like a 45-day, you know, period to you know. So you know, from Thanksgiving all the way through to New Year's. But there are three kinds of, I think, categories of treatment, right, for depression and any of the other mental health conditions. One is medication, and you know, obviously you would need to be assessed by a doctor. And when I say a doctor, I'm talking about a medical practitioner, a psychiatrist or general medical practitioner. And there are a whole variety of antidepressant medications that are out there. Number two, you have therapy through either through seeing a psychologist, a social worker, a professional counselor, that type of thing, to help you process. And you know, so counselors help individuals process and work through issues and life dynamics and that type of thing. And counselors also expose their clients to a variety of options. And that's why, you know, but here's, you know, the funny thing about that is when people have healthy relationships and they have a good support network, they're likely to get some of that warm and compassionate and therapeutic value in their normal relationships that they're actually receiving from a therapist. That, you know, that's the funny dynamic about relationships. So relationships are very important. So I talked about medicine, I talked about therapy, but here's the other thing. The third category is self-care. And self-care is inclusive of wholesome relationships. So that means being around the right people, the right places, and the right things, right? And I'll say it again, being around the right people, the right places, the right things, right? Involving yourself in the right activities. That's very important. Here's the funny thing. Individuals that are diagnosed or suffer with major depressive disorder or clinical depression, the serotonin in their brain is not firing properly. Serotonin is a neurotransmitter, akin and very similar to dopamine. So these neurotransmitters actually come into play when individuals are faced with challenges. You know, that can be the loss of a job, a divorce, death of a loved one, natural disaster, even other traumatic experiences. And neurotransmitters is the brain's way of helping the individual to cope with those circumstances.
Okay.
Does if that
Makes sense.
if that makes sense to you?
Yeah. And so, those that are watching, just drop if it's something isn't clear, just drop it in the comment box. I didn't mean to cut you off, Thurston, but we have some folks watching. So if you have any questions, just make sure that you drop them in the comment box. Okay.
Right. So the neurotransmitters is the body's way of releasing these chemicals in the brain to help the body and brain compensate for the added pressures and the added stressors, if that makes sense.
Makes sense.
But
yeah.
with individuals that suffer from depression and even anxiety disorders, right? These neurotransmitters are not firing properly.
Got it. Yeah.
Does that make sense to you? And that's very, very complex. So one of the other things we don't want to do, and many of us probably have done this. I know I've done this years ago before I got into the counseling field. I'd be talking to somebody depressed, and you say, "Man, snap out of it."
Yeah.
Well, it's not that simple.
Not that easy. Yeah.
You can't just. So number one, they've got some chemical challenges going on in their brain. And then number two, individuals that are suffering from depression are not talking to themselves correctly. That's the other challenge. So what's often frequent, and that's why talk therapy, that's why seeing a counselor is so very important. So what happens with individuals who are suffering from depression, they end up communicating things to themselves that really reinforce the depression, and which is why they stay in that depression for so long.
No, that makes perfect sense. And thank you so much for breaking that down to explain what is happening with the brain, with our body, and the communication that's taking place.
Right.
Very important.
Let me give you some examples. One of the criteria of clinical depression or major depressive disorder is feelings of guilt. Now, guilt is about what happened yesterday, right? Hopelessness in the present, lack of interest in activities with a very abysmal perception about what's likely to happen in the future. Individuals that suffer from depression communicate words of worthlessness to themselves that help them to stay right where they are. That's why depression kills. Right. And mind you now, because the individual has such an unhealthy relationship with themselves at the moment, it's extraordinarily difficult, if not impossible, for them to maintain any semblance of a healthy relationship with other people. So if you're a mother and your father and you're suffering from depression, it impacts the relationship that you have with your children and others. That's why it's so very important. So here's one other thing you do not want to do. And if it's accessible, it's not uncommon, but it doesn't make it good. So understand where I'm going with this. If it's accessible, individuals that suffer from depression have a propensity, at least at that moment, to start abusing alcohol. And it would not be difficult for them under those circumstances for them to develop a dependence upon the alcohol for a few things. Let's look at what the alcohol would do. Number one, the alcohol would change their current mood. right?
Mm-hmm.
Depression is
Right.
mood disorder. So the alcohol changes their mood.
Mm-hmm.
Number two, it puts them in a different framework and mindset because their mood has changed. Number three, it gives them an alternative, meaning that, well, I would, if they start drinking and they start drinking regularly, then they, the alcohol becomes the alternative or the option to, it's either stay in bed or, or drink. You see what I'm saying? And that's why, and that also occurs during the holidays. And which is why folks just need to be cautious.
So true. And Thurston, when you're talking about how one could use alcohol as a coping mechanism, which of course that's why it's so important for us to develop healthy ways to cope with different experiences that we have, especially traumatic experience in our lives. But when we were talking about loss, that is one type of loss when you're looking at someone who has transitioned or divorce. But could you also experience loss if you have a loved one who has a substance use disorder and the person that you once knew, it's no longer them that's kind of in front of you because this substance has really taken over their life? And so that could make the holidays even more challenging, especially if they maybe show up at a family dinner, or just dealing with the emotions of the relationship that you once had that has now been changed because of the substance use disorder. So families that are dealing with that, can you speak to a little bit of how they can kind of work through that as a family unit?
Well, exactly. Well, if we're talking specifically, Kai, we're speaking at least momentarily specifically about individuals that have a history of substance use disorder and or are currently enthralled in substance abuse, addiction. And you have to keep in mind, those individuals are there, right? But they're not present, right? And it's because the psychoactive substance interferes with the intimacy and the wholesomeness of the relationship. And so what's important is, so listen, there are some individuals that have been raised in families and they don't know their family to be any other way but abusers of alcohol and other drugs. And that's really, really unfortunate, because children that are reared in that environment have nothing to compare it to. So as far as they know, that environment is what home life is supposed to look like. Now, if you were raised in a generally healthy environment, and then there is a family member, loved one within the family that becomes unhealthy, either because they have some type of mental disorder or it could even be substance abuse, then again, because we talked about this at the beginning of the show, then again, you have something to compare it to, and you know that there's been a marked or distinct change between what you know that person to be in terms of their values and their standards and how they conduct themselves, as opposed to what they are doing now and where they are now and what their conduct and condition is now. So you have a framework in which to begin a conversation. And then you also have a lineage in which you're able to clearly measure, this person wouldn't step out of the house unless they were pressed and cleaned and shaven and, hair done and all of that. And over 5 years, I'm looking at a totally different person. And so we have to also understand whenever we're talking about any of these conditions, we have to understand that the individuals that are suffering with these conditions are in fact suffering, and they are unhealthy, and they really need help, not criticism. You're not going to criticize or scold somebody into healthiness. That's the other thing that doesn't work. Here's the other thing that I wanted to share earlier that I think is so very important, particularly going back to the depression piece. Exercise is one magical treatment for any of those mood disorders. And let's look at, let's just talk a minute and look at what exercise does. Number one, individuals, we already defined that individuals that suffer from clinical depression, the neurotransmitter or serotonin is not functioning properly or being released properly in the brain, or not being released at all. Exercise releases all kinds of neurotransmitters and just makes you feel absolutely great. If individuals, even individuals who suffer from mood disorders, anxiety disorders, depression, would exercise, they would feel better. Exercise is a game changer. So the reason why I'm referencing this, Kai, is because there are some things that individuals can do that will have in some instances, a far greater impact than all of the other alternatives. So even though an individual that's suffering from depression may feel that they're in a state of hopelessness, and part of that is because of how they are communicating to themselves, they are not hopeless. And it is not a hopeless condition. And here's the other thing. Even the Bible talks about be anxious for nothing, and everything through prayer and supplication. Although I am a minister, there is substantial research, substantial data out there to support the value of prayer and meditation to improve one's health. So even from that aspect, I would encourage individuals to establish a prayer life. One of the things that we do know, and I don't think anybody would argue whether or not they're a professional or a layperson, whether or not they're experts in mental health disorder or know absolutely nothing about it. One of the things we all would agree on, Kai, is that you can't continue to do the same thing.
That's right. Yeah.
And
that's true.
We are all convinced about that. So you can't stay in the bed all day.
Mm-hmm.
Shut the blinds and stay locked in all day and that kind of thing. So we all agree that individuals that are suffering from these disorders must do something different in order to come out of that condition.
Yes, so true. That you dropped so many gems there, Thurston. I did want to say, as it relates to prayer and meditation, I'm glad that you brought that up, because this was about a week or two ago. I co-facilitated a continuing education training in which it was regarding mental health with the older adult population. Yeah. And so I talked about it from a holistic perspective, in which we went through the different mind-body therapies in CAM, the contemporary alternative medicine. And so there's 5 different categories within CAM, and one of it is mind-body. And under that category is prayer and meditation. And research does show the benefits of prayers and meditation when someone has been diagnosed with depression or anxiety. that there is evidence. If you're a person listening, you're like, I need to see the science. There is scientific evidence that backs that. And you can find it in many of these medical journals now, because they're starting to kind of include what they consider alternative medicines in the research. So you can definitely, I'm so glad that you mentioned that, because that's actual science now backs it. If someone is kind of like, oh, I don't know about, that woo woo stuff. But if you need the hardcore evidence, it is there that it has been proven to help people that are in those type of conditions.
Right. And so going back to the theme about your, mental health in the holidays, this is a tough period for lots of people. And I'm going to be quite frank with you. For the past couple of years, though, and obviously we're in the United States, we've been in one crisis out of the other. COVID, social unrest, political, turmoil. I live now in a city where that was just per U.S. Justice Department statistics, a city that's been now termed or labeled, if you will, the most dangerous city in the United States. All of these things are anxiety producing. There's a phrase a term that I heard from an old clinical supervisor and mentor of mine years ago, and that term or phrase is, hurting people hurt people.
So true.
Right? And so we are also continuously bombarded with responding to dysfunctional behavior all around us. This is precisely why. And these are abnormal things. And that's the other thing that we need to do. We need to start validating and calling things for what they are. We are now surrounded with so much lies, so much distrust, so much violence, to where many of us, Kai, have grown accustomed to it. Many of us, if you will, have become desensitized, so desensitized to the dysfunction, to where the dysfunction is normal to us. And that's abnormal. So that's the other thing that I want to share. That's abnormal. If the dysfunction doesn't bother you, then something is wrong. We should all be disturbed by all of these things that are in disorder around us. And that's more reason why we have to be on our P's and Q's constantly. And we really do need to develop a strategy of self-care. Rule number 1, wholesome relationships only. Now, that doesn't mean that you shut out family members and friends that are struggling. That simply means that you prioritize who, where, how, and why you're going to spend your time. That's number 1. Number 2, as it relates to those family members and friends that are struggling, that you don't want to shut out, you simply need to manage and establish some boundaries in terms of how much latitude and what's the extent that you're going to avail yourselves to those individuals. And the reason why I'm saying is, we just need to be careful. We need to know what our threshold is in terms of how much stuff of other people that we can tolerate. Number 3, we don't just need safe spaces, we need brave places.
I like that. Yeah.
Okay. And that means we need places where we can go and vent. And the reality of it is, I think all of us at some point, time or point, right, or at some minute of the day, right?
You got that right.
And some, you know where I'm going with this.
I sure do.
At some time of the year, right? And even if it wasn't but a minute in 1 month 2 years ago, all of us are probably could be diagnosed as needing a little mental health assistance ourselves.
It's so true.
Right? So with that, and I'm glad that you found that funny. You know, it's okay to say, you know, I can't do everything, right? I'm not Superman or Superwoman today. And I need some TLC. I need to vent. I need to be around some folks. I've got some challenges that I'm dealing with myself. So we have to understand that we can't take it on, and you and I work in the helping profession. So we're out there, right? And we're working with people. But there's an old medical phrase, and I think it comes from Latin. I don't know the Latin term, but I know the English phrase. And that English phrase is, physician, heal thyself. Right? So we are also required to take care of ourselves too. Because people like you and I are noted, in just about every industry that I've worked in, counseling, health and human services, volunteerism, ministry, all of the fields that I love, right, are all fields that involve working with other people, right? But
that's right. Yeah.
But we have to understand that we have to, we pour out a lot, so we got to be around folks that pour into us. We have to get refueled and get replenished and that kind of thing. And that's another reason why holiday season is so challenging for many other people, because many people, because of their standards, do not feel 100% fulfilled unless they are able to meet all of these obligations. And with many people, and even I used to think this way, that I got to get gifts for everybody. And
right.
And knowing I didn't have the money to get gifts. Right? So that kind of thing, some people feel under a tremendous amount of pressure to do that. And someone really needs to tell those individuals, you don't have to be perfect. And do what you can and that kind of thing. And this is why we have to be mindful of the pressures that society somewhat lays on us regarding the Christmas season and everything that goes along with it.
So true, Thurston. And it is true. You have so much pressure that we place on ourselves to try to show up for everybody, so many of us. And what I always say, and this is something that as of late has been really on my heart, is that I can't pour into someone else if I myself am depleted.
Correct.
I can't. And I'm doing a disservice to the individuals I'm trying to help. Correct. And I'm doing a disservice to myself and those, for me, for my husband. If I'm unable to show up for him how he needs me because I'm giving myself to everybody else and I don't have enough for myself, then I'm not going to be able to show up as I need to show up as a wife.
Right. Correct.
And so it's so important for us, as you said, begin to prioritize our relationships, set up those healthy boundaries. And that's something that we do, hopefully, that through watching the podcast and people that are interacting with the work that you're doing, Thurston, that people are learning the importance of setting up those healthy boundaries. But I know sometimes during the holidays, we can start to waffle on those healthy boundaries because of those added pressures of being around family. Right.
And the irony of it all is you end up killing yourself for a time that's supposed to be about bringing people together.
Right. Exactly.
Right. So you don't want to do that. But this is it's great conversation. And as I told you a couple of weeks ago, former South Carolina State Representative David Mack in Charleston, South Carolina. I know you're in North Carolina, so one state over from you had a discussion on this same topic and invited me to join his show to discuss this. Very important topic to discuss that people really need to understand, because folks get, really, some folks go into a really deep state of depression during this time period. And some folks have stayed in depression. Some folks, one of the things that I didn't mention, some folks, there are people that we know that are clinically depressed, but we don't know that because that is their baseline.
Yeah.
But if they actually went and sought assistance and got help, you would see a change in their disposition. But we don't know any different because from the time that we've known them, they've been in that condition. But some of those individuals are fully depressed. And then we have individuals that go into the state of depression and their entire lifestyle changes. Who they interact with, the lack of interest in important things, they don't want to go anywhere, that kind of thing. And it's dangerous because depression is also a catalyst for suicide. And we don't want that.
Exactly. And so what you've said, Thurston, laid out is that like the science of it, what's happening with our brain, the relationship and the communication that happens between the brain and the body when someone is clinically depressed or someone that suffers from anxiety. You also talked about substance use disorders, how that impacts an individual, and also the family members as well. And so hopefully for those that are listening, what you've kind of gleaned from this conversation tonight is the importance of the relationship that you have with yourself, because that is kind of what was woven throughout what you've provided tonight was important of what's that inner dialogue that you have with yourself. And if there is an unhealthy conversation that you're having, there are healthy ways to go about getting help. Maybe the route is talk therapy. Maybe the route is talk therapy combined with a prescription. So the resources are definitely out there that you don't have to suffer in silence. You don't have to be ashamed, but you can definitely get the help that you need, not just for the holiday season, but really to reclaim your life and live the life that you want.
Exactly. That's right. You only get one you, right?
It's so true. We got one shot at this, so you might as well make it worth it.
That's right. Exactly.
So Thurston, we're starting to wind down our conversation tonight. So again, thank you so much for coming on the podcast. Before we went live, I already was trying to get you back on. So, so that's already a work in progress with that. But is there any last words or parting words, I should say, that you would like to leave with our audience tonight?
Well, so we are in the holiday season. What is today? Is today December 14th?
14th, yeah.
Today is December 14th. Enjoy yourself. Be safe. Be cautious. Watch your surroundings. Enjoy your family. Enjoy your friends. If you drink alcohol, moderation. If you don't drink at all, then I wouldn't encourage you to start. If you have a history of depression, then be mindful of your intake of alcohol. I would discourage it, totally, to be quite honest with you. And just have a wonderful and safe holiday season. And Happy New Year.
Yes. So again, Thurston, thank you for joining the podcast today. This is actually the last episode for 2021, and I couldn't close it out, the year out. I couldn't think of a better person to close the year out with. So thank you for joining me.
Thanks.
No, it's been my pleasure. For those that are watching, I will have videos that will be posted as we start to wind down the end of the year, and that will just kind of be different videos that were different interviews that I did throughout the year, just little snippets of those. So please take a look at those. I'm sure you will enjoy. And if you enjoyed the information that was provided tonight, please give this video a thumbs up, and please also share with your network. As Thurston said, this is important for us to get the message out that if you are a family member that has someone who has a substance use disorder, if you yourself are suffering with a substance use disorder or depression, anxiety, there is help for you. And so we want to make sure that you know that you do not have to suffer in silence, and you don't have to feel ashamed. So that being said, you all have a wonderful night. Have happy holidays, and I'm wishing you a joyous, healthy, prosperous, and safe new year.
Thank you.